As Michelle said, I am Stephanie Bryan, and I'm a Program Officer, Consumer and Family Liaison at the Hogg Foundation for Mental Health. And I'm pleased to be here this afternoon and to have the pleasure of introducing our last but not least guest speaker, Chacku Mathai. Beginning in 1985, Chacku's personal experience as a youth and young adult in mental health and addiction recovery led him to delivering public presentations in schools, universities, police academies, criminal justice, and prevention community events and conferences, such as the Office of Court Administration and Youth to Youth. He initiated the development of some of the first peer-run addiction and mental health groups for children and adolescents in Western New York, within their residential programs and treatment facilities. Today, 29 years later, he's the director of the Simpsons. Oh, wow. Yeah, Chacku, you've made it, man. You've made it. Woo. It's been a long day, y'all. All right. Today, 29 years later, he is the director of the Systems. Woo, I got it. Systems. Where was I? Here we go. Transformation Initiative for the National Alliance on Mental Illness in Arlington, Virginia. The NAMI Star Center is one of the 5 National Technical Assistance Centers that provides a technical assistance to facilitate the restructuring of the mental health system by promoting recovery and consumer-directed approaches. I thought I had a tough job. Good luck. Chacku has been one of the champions of the Substance Abuse Mental Health Services Administration, the Brass Tacks and Recovery to Practice Resource Center program. He is a true standout in his field. He has a great understanding of the program and a great appreciation of what it takes to truly bring recovery to practice as a way of doing business versus being the exception to the rule. Finally, he is also a very fascinating person. He's a great guy, and we're all in for a great treat today. Without further ado, please join me in welcoming the very comprehensive, y'all know what that means because you just listened to Larry, the very comprehensive Chacku Mathai.
Thank you, Stephanie. That's okay. Yeah, it looks like it turned off. Okay. So thank you. Is everyone still out there? All right. Oh my gosh, thank you so much for sticking around. That's good. After following, one of the hardest things, Larry said it was hard to follow lunch, and then it was hard for Anel to follow Pat. I had to follow all 3 of them, right? And so I am really so grateful to be here. I'm going to try to stand away from the podium, actually, because I want to be here. One of the things, last time I was in Austin, some of you might remember I was hobbling around on crutches, right? I had torn my Achilles tendon playing soccer in January. And boy, it's been a long process, but check me out, I'm walking now. I tried on some cleats again and started playing with the soccer ball a little bit. My daughter is so happy. I have a 6-year-old daughter. My wife is very happy. She doesn't have to do quite as much for me as she was before. So it's and a lot has happened since I was here last already. So I can't catch you up on all of it though. As Stephanie said, there's a lot of changes in my life. I just started with the Star Center and with NAMI, and we've really certainly hit the ground with a lot of great work. So I'll come back and tell you about all of that. But I am so happy to be here and have the opportunity to talk about peer support and I'll spend some time talking about how it's affected my life and really some of the evolution of our movement and the relationship of peer support in that movement. So, I have to tell you though, you have here, when I look around, just in this conference alone, people, all of the speakers, not just those of us who spoke today, but everyone is a keynoter in their own right. In this, you have it. This is a jam-packed conference with some great speakers and presenters, and it's an honor to just even take a turn. That's kind of how I look at this. Is I'm just another one of us taking a turn at the mic, and it's next time it's one of yours, you know. And I was in the back of the room, never wanted to really be brought up to the front, struggled with any belief that I had something to bring forward in the first place, you know. And so I appreciate it when I see my mentors out in the audience. You know who you are. I mean, and I'll talk a little bit more about that. So let me step back for a minute and just say thank you for all of that. Thank you for happy birthday to the Hog Foundation for 75 years. And congratulations on a great seminar. But you know, Michelle and Susan and Octavia, you know, you've all been, and Stephanie and Tammy, you've all been just so good to us. If you like what the program's done, then you know all credit goes to them. If you don't like it, you know, you can blame them too. You know, that's fine with me. But I think where I want to start with is tell you a little bit about where we want to go. So these were 4 objectives that I wrote at the beginning, I think, you know, several months in, but I think we're going to be able to really cover 2 of them, number 1 and number 4. So we'll get into the evolution of peer support, not as far back as Larry got into, all right, and so that would take a while, all right? So I'm going to go back to maybe the 70s, all right? And then a little bit later when I started to show up. And then this last objective of being able to talk about the opportunities and the challenges that we face. All right? The other 2 will probably hit. We're probably going to get, and you're going to make, I'd like you to make your own observations about that. What is it that as we discuss this process and this evolution of peer support, and as we discuss the opportunities and challenges, what is the role of lived experience? What is the role of social identity? What in this new environment of healthcare? All right, so that's a significant challenge that I'm not just going to speak to. We all need to be thinking about. How's that sound? Does that work for an agenda? Okay, I think I can cover that much in this amount of time that we have. So, you know, I mentioned my daughter. I have to, you know, she's got this incredible smile. You know, her name is Showba, which means brilliance, you know, and light. And, you know, that's what it's an adjective in many Indian languages, in my language as well. And so you describe, you know, someone as Showba, you know, the brightness and when they smile. And so when I remember when I smiled like that. You know, actually, I'm going to use this clicker here so I can not go back and forth. Here's a picture of me. Some of you have seen it already. I've presented on this in the past, but there's me on an elephant in India on one of my visits back. I'm Indian. I'm born in Kuwait, and then I became a United States citizen, you know, in the 2nd grade or so. And you know, and this is just, you know, about a year before that, on a 2nd or 3rd visit back to India, the one I remember anyway. And I smiled big. I smiled big, like Showba does, at that time. And I remember that smile because of how connected I felt to that elephant. I remember that smile because of how much belonging I felt when I walked through the sugarcane fields, when I walked through the village, when my elders and my uncles and my aunts and my cousins all looked upon me and my family. Because they could see that, I could feel that I belonged to them, that they belonged to me, that I had a sense of importance, a sense of purpose. That elephant, there were water buffaloes, there was a river that I swam in. I swam big when I was in this Pamba River that was near our village. And I wasn't supposed to swim in there because there's snakes in there and stuff like that, right? And I'm swimming in that river and I'm hiding from my uncle, and there was laughter in my smile, you know? I mean, this was my place. And I also remember the smile and the feeling of, because not only because I feel strong and capable and related and belonging, but because of how I felt before and after I was there. So just before, even on the way to India, on that very trip, you know, I saw my family and my parents in particular judged for how we dressed and for our language and for our accents. I saw my father treated very roughly. I saw how he was angry but didn't, contained it, so that I would be safe. I wondered when it happened to me how I would act. I didn't know. And when I left and had to go back, I remember, I was bullied and we were threatened, and I just fought. All I could do was fight back. I did everything I could, to retain whatever dignity I could. When a teacher told me not to speak my own language because we were in America now, and that I was just trying to explain that this is Vellum and it's water, how you say it is how I say it, there's some things, I was just trying to explain. But instead, I was judged for who I was. I didn't feel like I could even control or belong, I felt blamed for things that were just about who I was, And just because they were distressing everyone else didn't mean that they didn't belong, right? And I knew that deep down inside, but it was starting to go away. I was starting to not sure. So that year was a long one. And I remember, not too much later, I started to find some relief. But I found it in smoking cigarettes. I found it in smoking pot. Found it eventually in some other drugs. I found it by trying to kill those thoughts and feelings that I started to have. And let me tell you about those thoughts and feelings. I started to believe that not only was it just those people at school, I started to believe that the world was just not a safe place. I started to believe that my parents and the other people around me wanted me dead. And this is where you start seeing this other gentleman in the picture there. I was about 14 years old, and as the years progressed up to that point, I stopped eating my parents' food. I believed people were trying to poison me and kill me. I started to see things. I started to notice things like people yelling at me that other people didn't seem to notice that were in the same room. And I started to have this shadowy presence in my bedroom that seemed to just jump around all night, and I would have to keep an eye on it because it would try to jump into me, whenever I wasn't paying attention. And the only way to get rid of it was to scream at the top of my lungs, and it would just go back to the corners of the room. I would try to find solace in some kind of actions and some kind of behavior. I was actually, at times, started getting into music, or I would get into athletics, some kind of sport. I loved to read. There was all kinds of things that I was finding some joy in, but, it just was overpowering. I couldn't keep up the effort, and they just started to lose meaning. Those roles started to lose meaning in the face of what I was trying to control inside of me. And so I silently, contemplated suicide for about a year until, about a year later after this picture was taken, attempted suicide with a drug overdose and ended up in the hospital. Now, about a week later, my father, who, we're Indian, we didn't talk about any of these things. We kept it on the inside. We didn't really even call 911 when everybody else did, And my father, though, instead that week, he reached out to another man at a church that he went to, and he explained, what was happening at home and to me. And this other man said two of the most important words that, changed the life of our family. He said, "Me too." And his son was also struggling, not just a year older than me, was also struggling with mental health and addiction issues. And it turns out that he and his son were now, just a month before, starting a new organization and bringing families with other children like us together. And they were renovating this old horse barn right across the parking lot from the high school we were going to. And literally renovating it. They put some ping pong table, a pool table, a bunch of couches, that kind of thing, a soda machine. Apparently that was their source of revenue, They kind of put all that together, and they called the Students of Brighton Encourage Recovery. And he said, maybe your son might want to come and meet some of the other guys and some of the women that are there, little girls that are there. And maybe you want to meet some of the families that are there too. And so that's what we did. And I walked in, and I don't know, like I said, I hadn't felt safe anywhere, but for some reason, when I walked in, these people didn't look like me, sound like me, talk like me, right? Any of us, But when I walked in, I surprised myself. I felt safe for the first time in 10 years. I was able to drop my guard because I had my back up all the time since I was 5, 6 years old, that I was going to have to fight my way out of something. And here I was now dropping my guard. And we all lived happily ever after. It was all good. There's a little more I want to tell you, though. All right? A little bit more. So you've heard a lot from Pat and Larry and now about what that process is. So I'm not going to go into all of the things about my process, but I do want to tell you about how peer support started to show up. That was my first experience of feeling the impact of peer support so that I would be engaged. We were engaged first with peer support as a family into our journey of recovery together. Now, 6 months later, not even 6 months. I mean, they came to me and said, hey, there's a group over at this children's facility we'd like you to go talk to. Or they'd like to have you go talk to them anyway, and would you go? So I said, really? I mean, I looked a lot different than I look today. I was still not sure if I was even doing very well. I didn't let anybody cut my hair, so it got a lot longer than that, and it just kept going. And I kept it over my face. I was about 100 pounds soaking wet, that kind of thing. I just wasn't really feeling ready for something like that. But they said, no, I think people will relate to you. Why don't you give it a shot? So that's what I did. I went, and it turned out there was a group of boys that were regularly in fights with staff and with each other in this children's facility. They were in seclusion and restraint. This is the mid-'80s, 1986 at this point. And, I started talking with them. I was thinking about it. It was funny because I was thinking, all right, how am I going to handle this? I'll say a little bit about what I've been through, maybe what I struggled with, and, a little bit about the barn, as we called it, and how that might be a resource to them in the future. But hopefully I'll get them talking so I won't have to say much. That was kind of my technique. If I can get them talking, I don't have to do a whole lot, right? I was just going to start, helping start a conversation. Turns out that's what happened. We had this great conversation. And so when we were done, the therapist who was there, she said, wow, that was great. Can you come back and do that again? I said, whoa, I just did this once. I didn't think I could. I wasn't, again, but am I ready for this? Was this something I should be able to do? I barely made it there. I almost canceled out on that one a couple times. I was nervous about it. And then the second, thing, will I even be able to get them to talk again? And then I realized something. It just kind of came to me at that moment. And I said, well, you know what? Maybe I will come back, but I need you to do something for me. And she said, what is it? I said, well, would you mind staying outside of the room this time? Now, those of you who are nodding your heads have an idea of why I said that. She said, why? I said, I have no idea. We didn't have a conceptual framework. We didn't have, certifications. We didn't have credentialing. We didn't have any of the stuff that told you why that might be important. But I said, well, I thought about it, and I said, I'm not quite sure, but I think that every time one of them was about to speak, they looked at you first, and I couldn't really tell if they were really saying what was on their minds, or if there was a different version. If they were saying what was really on their minds. Now, is this going to kick back up? I think it might. There it goes. Okay, so, thank you, Michelle. So, considering that, one of the things that I wanted to reflect on is that peer support You know, there's a saying, it's adapted from the Quran. One of the lines that's most important is that, you know, we are, it doesn't say we, but it says that we are gardens beneath which rivers flow. That's always been so beautiful to me. And so when I think about peer support, and I'm going to tell that story a little bit today, we're going to tell the story about how peer support has been that river. All right, it has been that river that flows and feeds the gardens of our movement. So if we think about what that means, you know, we want to think about all of the ways in which peer support has been a source of strength for our movement, and where it stands in that regard today. All right, so I'm going to return to this thought throughout the process, but I want you to think about that too. So when we think about that, we're thinking about, wow, at the same time that I was in that moment, the same time that I was saying, I'm not sure if people are saying what's really on their minds. I didn't know it, but for like 10, 15 years, pockets of people all around the country were starting to say what was really on their minds. All right, and that's what we're going to discover, what was really happening in those pockets. So if you look at this, really we're talking about a transition period from the 70s to the 80s to the 90s and into the 21st century. I was saying, Larry, welcome back. I was saying I'm not going to go back to the 18th, 19th century like you did on peer support. You covered that very well. Thank you for that. I can say very confidently that I have been raised by this movement. And with the literature that came from Sally Zinman, Ray Unzicker, Judy Chamberlain, Pat Deegan, you know, David Oakes, there's all kinds of people, Larry Frank, there's all kinds of people that I learned about those pockets. And in the 70s, just to give a brief point around here, the pockets of effort, you know, remember that was the era of deinstitutionalization. So, you know, the funding for hospitals was being pulled back, all right? And people were now being let out of the hospital into the community. Now, not only was it the era of deinstitutionalization, but it was an era of frustration and outrage about the harm, the rights violations, and the trauma that was happening in the hospitals and in the system at that time. So the people that were coming together on college campuses, on campgrounds, you know, wherever they could in the 70s to actually talk about and validate each other's pain, validate each other's feelings, and to raise consciousness around the fact that what we heard earlier was that, yes, despite the trash or despite the way in which you were actually treated, the fact that you might have had an instinct that you deserved better or that you were different is actually true. You are somebody that is whole. You are not broken. You are somebody that deserves to have the dignity of risk. You have the right to have your civil rights honored, right? Those were the messages of our consciousness-raising peer support effort at that time. Yes, it was also about the movement. So, I mean, I know I'm taking a slice of our movement's work here. And by the way, some of this, if you want to get really into some of that movement literature, there's a presentation, a great one that was done on a webinar by Sally Zinman and Gail Bluebird. A lot of this content is referenced there. All right, so at that time, that's what we were doing is it was very local, autonomous, locally controlled groups, not taking any money from the system. In fact, very separatist and autonomous from the system. All right? There wasn't an interest in being a part of the system. In fact, it was all about alternatives to the system. It was about patient-controlled alternatives to the system. So the ex-patient movement that I'm referring to now was about really saying, wait a second, who are we? So we needed to have a time of really figuring that out. Just like you might as an individual, we needed to do that too, right? We needed to take some time. Well, what are our core values? What are the things that we believe in? Well, you know what it came down to? Liberation, self-determination, freedom, right? From oppression, from an oppressive force that happened to be the system at this particular time, all right? And so all of the other layers of the civil rights movements were happening as well, right? Women's movement, people of color, all of the issues that were being faced at that time were starting to be showing up, but this was one of them that needed to be brought forward. So I can't emphasize that enough, that at that time, the 70s, and that's what I mean by the river. The peer support at that time was feeding what we really saw as the gardens of our movement all across the country. Now, a lot of the things that people were calling for change around in that expatient movement were starting to show up in the 80s. Now, that's when I started to show up, right? And so I didn't know it, but somebody coming to ask me at some peer-run program to go do a group was a result of some system reform that was happening that I just didn't know about, you know? So some people were actually following through on something that said, you know what, this might be a good idea, why don't you try that? Now, the way I heard it was a little bit different, but another way I heard it was, nobody wants to do this stuff, we thought you might. That's kind of how it was so told to me, you know? We can't find anybody to do this, maybe you'll be the sucker that does, you know? So would you be willing to try that out? So I said, sure, you know? I wasn't doing anything better, you know, at the time. So I said, yeah, let me give that a shot. So not only that, but in the 80s, we did start taking some money. That's when our first drop-in centers were starting to get funded around the country. There's examples of that. That's when we started getting actual NIMH funding, all right, to do some things and some demonstrations of peer support. Our first alternatives conference was funded in Baltimore in 1985, the same year that I showed up. I didn't even know about it. You know, that was what was going on and being planned. Judith Chamberlain, you know, wrote her book in '78 on patient-controlled alternatives, right? Being in our own voice, on our own. I mean, she said it directly. She said, you know, this is the time for people with mental illness to bring out our own self-determination and speak for ourselves in a time when we have lost power. So that kind of emergence in the 80s was really, really new. And so some of us were trying to promote it and make it happen in those areas, but it wasn't necessarily taking hold. But I got to tell you, in the 90s, things started happening. Bill Anthony, Larry mentioned earlier, at the Center for Psychiatric Rehabilitation in Boston University, called it the decade of recovery. You know, it was this, and that was a time where then they came back to me and said, you know what? Remember you said you'd be willing to do that peer support thing? And I'd already been doing it in some adolescent programs and some residential programs here and there. And they said, we're trying to get people to do this psych rehab thing, and nobody wants to do it. So would you mind taking a training and becoming a trainer and maybe trying this stuff out in a residential program? You know, we'll learn from what you do, and we'll train other people, and we'll train the rest of the system with you. That's really how I got my first steps into really helping change some of the way in which the system operated was through psychiatric rehabilitation. So I said, sure, free training through Boston University, you know, I'll take that, you know, and get a chance to learn how to be a part of this and be part of training. And next thing you know, I'm one of 8 people in New York State who are training in psychiatric rehabilitation and learning how to make changes at the residential level and at the outpatient level, ambulatory level, and inpatient level. It's kind of cool. Now, I can keep going, but that's where the 90s major systems funding started to show up, and both in mental health and addiction as well, late 90s as well. And then in the 21st century, we started to see all kinds. So late 90s, peer specialists started to get hired in a few different hospitals, and then boom, let me kind of pop it up here. Here you go, right out of here, Texas University, right? Your Institute for Mental Health, Excellence in Mental Health, just did a report, a great report, on all the peer specialist implementation and certification around the country. Now, this doesn't include the addiction recovery supports that Larry mentioned earlier. So, you know, there's going to be some more work coming forward to demonstrate how we're doing in that regard. So you're going to start to see a number of different kinds of things. So you're also going to see not only peer specialist implementation, but we're already seeing, and including some of the stuff we demonstrated, some specialty areas. Oh, by the way, those of you who are looking at your printed handouts, I have 3 different kinds of presentations going on right now. The one you have in your printed one, the one that's up here, and then the third is the one that's going to go on the website, which is even different than what's up here. All right, so just try to keep up. I dare you, you know. All right, so check it out. So with the specialty areas, you know, it wasn't just about implementing a broad-based general, which is great, peer specialists that we're actually now hired within the system or hired by providers, right? But there were also peer-run organizations running groups like peer-run crisis diversion, warm lines, respite houses. Peer bridging was the stuff that we started working on in NIAPRS and really working. I'll tell some stories about that. Really supporting people to get in peer wellness coaching and recovery coaching, helping people with rights protection and advocacy, really working on the kinds of supports in housing and employment and education, really getting at those social determinants of health that mattered to us, right? And doing that in a way, just like the independent living centers were, doing it in a way that we could understand and appreciate and connect with. Ombudsman's another rights protection service, taking grievance and complaints within the system. And this is something that Larry was talking about, health activation in primary care. Those are some of the emerging specialty areas. Peer navigation or system navigation in healthcare. These are all, again, emerging opportunities that we can start becoming prepared for. So when you do that, I want you to consider there's going to be some national reports coming that you can start to expect. Brass tacks is one of them. That's the Bringing Recovery Supports to Scale Technical Assistance Center strategy. That's one of the corrections I made. The website there is at the bottom of this one. You'll get that before. So there's some great reports. That report on the overview of peer recovery coaching and the involvement of certification implementation, that's going to come out of brass tacks. There's a report that Steve Harrington and INAPS started the development of, and in concert with Faces and Voices is working on the national standards for peer support, and really great work, Steve and INAPS, and let's give Steve and INAPS a round of applause for that work. That's really important because we put him through hell. We really did. Not just him, of course, you and Rita and others that were involved, but there's no question that has been a needed effort. It was in your situational analysis that we didn't have one, and we needed to move forward to having some sense of what does it mean to be doing peer support across the country? What does that really look like? And I'm going to talk a little bit more about that. And the same thing with core competencies. What are those core competencies across addiction and mental health peer recovery support? So expect those to be coming out soon. Participate in them and ask for them if you haven't already. So I want to think about the ideas that we're going to here with these specialty areas and these opportunities. All of these opportunities are we're on the cusp, we're right in the midst of some of them and on the cusp of some of the others. So some of you are involved in healthcare reform priorities in other states, right? so maybe here in the future, keep working on that. You might, that's the most I can say right now, right? But the Medicaid redesign, let's use that as an example. People were recognizing, hey, that in New York alone, for example, 75%, 80% of the Medicaid expenditure was incurred by 20% of the Medicaid population. Who were they? Those of us with co-occurring addiction, mental health, and physical health issues. All right, so there's an opportunity there to really show what peer support can do in supporting people in those situations. This triple aim, this is the idea that we want to have a system that actually improves health for the population, for all of us, for our communities, that improves the quality of our communities and also reduces cost. And that's an actual opportunity. Again, that same issue of wanting to demonstrate that costs can be reduced. Now, I'm not going to say that there isn't a challenge there. There's a couple challenge slides that we're going to go through, right? Managed care, health home networks, getting these state standard or national standards and state level standards implemented and the core competencies implemented. And then also, of course, recognizing the opportunities for understanding what kind of program design, what kind of management do we need, what kind of evaluation do we need. Those are all not only challenges, but in this case, opportunities for our peer support movement. Make sense so far? All right. Considering those, I want to step back again into what we just reflected on with the 70s, 80s, 90s, all right, and today's environment. What and how did peer support change? Okay? So what changed over the decades there? So at one time, we were about raising consciousness about liberation and freedom. Well, peer support in the 80s started to change. It became about providing some services, didn't it? All right? So we might have been still doing some advocacy and some consciousness raising in some areas, but then we started having some service responsibilities, and we started getting funding for drop-in centers and other kinds of services, and we started to take on kind of a provider role, right? Now a more significant role in the system, and as a feature of the system, actually. And that same thing is true in the 90s and now most definitely in the 21st century, right? Where our peer support face is a feature of the existing mental health system. All right? So is it a feature, as Pat Deegan would put it, a feature of disruption, of innovation? And that's what we want to make sure about, right? We want to make sure it's a feature of disruption and innovation. So let me tell you, the other thing that we want to make sure is that it's something that retains the integrity of the experience of peer support in the first place, all right, and protects the integrity. So how do we do that if we are going into and maybe even mimicking some of the same helping relationships or helping models that we were trying to change in the first place? Okay, so we came onto the scene to offer some alternatives, and then became part of a system. How do we pay attention and reflect on what those changes look like? So I'll tell you a couple stories. One is about Sherry Mead. Sherry Mead was in New Hampshire and started to pay attention to some of this stuff showing up, and as early as the 80s, most definitely, and into the early and late 90s, had been starting to develop peer-run crisis respite opportunities in New Hampshire. And she was reflecting on the same notion that I'm talking about now, which is what's really different about what peer support offers. What is it that we do that is unique to us and is essential to people who are showing up in the crisis respite environment? So when we started to think about that, that was at one point called trauma-informed peer support and is now recognized as intentional peer support. So in other words, what is the intention of peer support and why are we looking at that intention? So when we think of that, means a couple things. One is that peers are coming together. We recognize that we all are starting to come together around shared experiences and with a desire to change our lives. All right, so that's kind of this common framework that we have. However, she recognized that without a new framework to actually build upon, people would frequently reenact the help that was often done to us. All right? Now, so if you have been, like I have, taken down and restrained, let's say, all right, that may not be what we want to do to other people, right, when we're a little uncomfortable, all right, or when we're angry. Now, I'm making light of that, but I really shouldn't. What I mean is we are at risk, every single one of us, without some reflection, reenacting the kind of help that we have experienced. And how do we create the reflectiveness about that in both our own individual work as peer support practitioners, as a program that manages this, right? As a set of administrators that organize this, as a system, all right, that really pays attention to this, as opposed to just throwing peer support in and hoping that it changes things. All right, that's because that's what we're sometimes doing. So that's what we're looking at. And that part of the answer was that we needed to look at how to offer this foundation for doing something different that included a history of our grassroots movement, that included the focus on possibilities that emerged with relationships that were mutual, explorative, and conscious of power. Wow, well, there it is. That we will actually be conscious of our power and our privilege as we move into the kind of support that we are doing. So regardless of whether you call it intentional support or whatever you're doing, how do we encourage that kind of work? So that story with Sherry, I go to a little bit further. So let's use NIAPRS as an example. I was with NIAPRS. We started the Peer Bridger Project in the early 90s, 93, 94 is when Harvey, Cheryl McNeil, Ed Knight, brought this great project together. Ed wanted to really see that peers support was more than just social enrichment and connecting. He was hoping that we would be able to show that we could do skills and supports, just like Psych Rehab said would be important, that we could teach skills, that we could teach supports, and that could be part of community adjustment and getting out of the hospitals. That's what the Peer Bridger Project was. It was working with people who were in state hospitals for a really long time or in and out of hospitals on a regular basis. How do we help individuals in those circumstances transition into the community, learn new skills, right? Build good relationships, connect with resources that were not just the system, but natural supports, all right? And maybe like peer support meetings, and go to some peer support meetings inside the hospital and out in the community. And that's the model that they started to construct. One thing they noticed, however, when I started joining the team at NIAPRS was that, hey, we have a great structure here, but we're not sure we have that framework that actually addresses the change that people need to go through in order to stay out of the hospital. All right? So let me give you an example of what I mean by that. I started working with Sherry and Laura Prescott and Cheryl and other people about the Peer Bridger Project. And we started going all around the Peer Bridger Project. We had 6 teams, and we were in 6 different state psychiatric centers around the state. And we would go around and ask people, what worked for them, what didn't, what was going well, what wasn't. And we started to construct our core values. We went back to the beginning. Who are we? What are our core values? And we talked about self-determination. We talked about mutuality. We talked about power. And we talked about trauma. And we just kind of started building the list. And what we discovered, and I remember we doing this training with Sherry, and I think it was maybe 2003 at this point. And Sherry wrote me an email. I'll never forget it. We just finished training for a whole week, 30 peer bridgers and team leaders from around the state. And Sherry wrote me an email afterwards. I couldn't believe she was writing me already. I was still tired after the training, and she was writing this email back to me. And it said, I wonder if what we are doing as peer bridgers is not only staying out of the hospital, or not only helping each other get out of the hospital and stay out of the hospital, but I wonder if we're really helping each other get the hospital out of us. She was on to something, huh? I think by you're saying she was on to something. I said, yeah, I think she's on. So that same week, I went to Creedmoor State Psychiatric Center, which is in Queens. And we had some peer support meetings there. My job was to visit some of these peer support meetings, and I was asking people this question. So we had this peer support meeting on the grounds in this hospital, and people were in a circle, and there was also invariably a group of people who were kind of either sleeping in chairs around the room, around the circle, or who were told they had to be there, but didn't have any other, in other words, they weren't really engaged, but they were just hanging out, right? But we didn't kick anybody out for that. We just had people stay there, and of course. So I asked people in this meeting, I said, so what do you think? Someone said to me that we might not only be about getting out of the hospital and staying out of the hospital, but she said that we might actually be about getting the hospital out of us, all right? Now, as I said that to this room full of people in the State Psychiatric Center at Creedmoor, just as I finished saying that, a woman behind me jumped out of her chair, right? The chair went flying by me. She gets up and she says, yeah, now that's what I'm talking about, right? Just like that. And I said, whoa, She says, are you going to talk about that, I said, we are now. That's what I said. Would you like to join us? She picked up her chair, came to the center of the room, and started a conversation, the best conversation in peer support that I have yet to hear, about how she had been carrying around that hospital every time she got out. How she had never, ever thought that it was possible to get the hospital out of her. And that maybe we could figure out that together. And so we came back, and I wrote back to Sherry. I said, yeah, I think you have onto something here. And we changed that to be our mission, and we started to recognize that our outcomes were not just about, as Pat said, about community tenure. We're not just about reducing hospitalizations. We're not just about symptom relief, right? But it was about getting the hospital out of us and what that meant to each individual who we were supporting in the Peer Bridger Project. And so reflecting on that experience was what we started to ask people to do. And we started to realize that at peer support programs all around the country, that every single one of us, in this case, we are always at risk of recreating the same qualities of society and systems that ignited our outrage in the first place. And that unless we actually address, just like Sherry noted it for us, right? That there are things that we are trying to do, that we might evaluate ourselves back into the same kinds of programs same kinds of systems. All right? So not only is the caution about having research that measures the same outcomes or program evaluation that measures the same outcomes, but that we think a little bit more about what peer support and the integrity of peer support is. So let me offer a thought. This comes from Emma Watson. I think some of you might have heard me talk about her in the past, but in the 60s and 70s, they were also organizing in Australia in the indigenous community against apartheid. And when they finally created a certain amount of awareness about apartheid and the kinds of experiences people were having, people said, oh, let us help you. Let us figure out how to help. How can we help? And this was Emma's line. She said, well, if you've come to help me, you're wasting your time. However, if you have come because your liberation is bound up with mine, then let's work together. So what that means is that it may not be the same liberation, may not look the same, may sound the same, whatever it is, but there might be differences, whether it's the addiction recovery community, mental health recovery community, it might be families, it might be peer communities. All right, there are experiences that are bound up, that the liberation is bound up together, that we have some opportunities to really deal with together. This is, for me, the heart of why in peer support we tend to come together, and the way in which our movement can actually feed itself. Now, I'm not saying I have all the answers. I'm just kind of pointing out some moments or glimpses of that in my experience. So this is, just so I want to make sure you recognize Sherry Mead is over there on the right, Eva Deck, Steve Morgan, Chris Hansen. These are people that are in the intentional peer support community and training all around the world. And finally now, just as an example of the way in which the framework is moving, we're starting to see an example of that kind of traction and a way to protect that kind of integrity. So let's consider that. The other thing that I want to consider is the effort that Pat talked about. And I don't know if you've heard her talk about it before, but she's talked about it as the intersection of love and outrage, where we connect with our outrage about a change that's needed, but at the same time we come together because we want to help, right? We have this sense of love and purpose that we want to bring forward. But that intersection creates many challenges. And so that also brings out this idea of a disruption that we're trying to pursue. So there needs to be a disruption, right? Yet at the same time, there needs to be some support. So let's go over some of these challenges that we looked at. We are growing rapidly. We are growing with such diversity all around the country. We have to really figure out how we're going to research all of these models. Or are we going to research all these models, and are we just going to identify some areas? Larry Davidson just said we have a lot of evidence growing. But one of the issues is that when they start to do the meta-analysis, they come back with reports that say, well, there's not a lot of evidence that shows this is working. And so what makes me worry about that is that we could be starting to measure the wrong things. Remember when Pat said we started to measure community tenure as outcomes and she was being evaluated? Those looked like treatment successes in her life, right? Well, that's what's happening here too. We're starting to measure the same things in peer support and risking looking like what I call snake oil, right? So what that means is that, snake oil at one time was a Chinese medicine that actually worked. And then there were snake oil salesmen that went around and started putting them in little bottles, and eventually there was no snake oil left in it, right? They just started diluting it, selling it around, and somebody actually opened the bottle, and I think it was the American Medical Association, if I remember correctly, and said, this isn't anything that works, this is quackery. So now snake oil is the relative equivalent to quackery. All right, so I'm not trying to be inflammatory here, but I worry about that if we don't pay attention to what we're actually evaluating in peer support and make a case to Dr. Insel and the NIMH to have research in the NIMH budget that actually reflects the level of outcome that we're interested in peer support. So I'm going to give you another example of that with a story. Here's a cool story. It's by a guy named Michael Patton, back in this creative evaluation days, quality evaluation days. A traveler to a new land came across a peacock, which is a bird in India that has these great big feathers. If you haven't seen them before, right? It's also kind of a an anomaly from an evolution perspective, so we won't get into that. But having never seen this kind of bird before, he took it for a genetic freak. All right? And taking pity on the poor bird, which he was sure could not survive in such deviant form, he set about to correct nature's error. He trimmed the long, colorful feathers. He cut back the beak and dyed the bird black. There now, he said, with a pride and a job well done. You look more like a standard guinea hen now. Right? So what he did is he cut it back to be something he could recognize, right? Something he was comfortable with, something he could manage and deal with easier, that could fit within the existing system, that we wouldn't have too much trouble researching, all right? That the Medicaid data is already there for that. So why don't we just use that? So I'm not talking, we could apply this to us as individuals, of course, right? But see, where I'm talking about this is where we end up doing this to our own movement of peer support. Are we evaluating ourselves to be guinea hens? Are we ready to strut like a peacock, right? Okay, thank you. And this is going to take some political will. This is going to take, we need to get to a place where we're no longer about the I story, which is the story about me and my story and my program and my, survival. And this is from Wilma Bodner from Denmark, who just said this at a meeting that Larry convened of the International Mental Health Leadership Initiative. She said, we're actually talking to people about what the we story is now. So this is going to require us to generate a will that is driven out of our we story, that moves from an I story to a we story of peer support that is exactly what we talked about earlier, that is going to be the flow and the feeding of our gardens of the movement. We need to be able to do that kind of disruption by doing a few different things. We need to create the culture of disruption in our environment. So it's not just about being innovative disruptors as individuals, but creating a culture that disruption can be expected. Right? So I just started working for NAMI, and I thought that I was just going to be an internal agitator and an innovative disruptor, and they would just kind of deal with that. Well, guess what? They're creating a culture of disruption at NAMI that makes this kind of cool. And they were like, yeah, we expected you to do that, thanks. I was like, oh, you're really? Oh, okay, you want that again? All right. That's what we do, And I'm pretty impressed by that. I'm hearing family members wanting to tell their stories and say, how can we have our experience reflected in the new work of our movement? Pretty powerful stuff. Engagement and outreach means feet on the street. We're not a system that's going to wait for people to come to us anymore. So that's an example of being, what's an opportunity for peer support that's really disruptive? Well, that's one, because we don't know what that looks like. In peer support, there are 4 things that have been really important to me, and one is that we're not about control. We're not about expert assessment. So what does that mean? So if you're going to start working in a primary care environment, and you're going to be asked, hey, why don't you be our lead screening person? All right? Now, I'm not saying that isn't something primary care shouldn't ask a peer supporter to do, but I am asking us to think about what's the decision-making process we go through. Are we going to do a screening, an illness screening? Is that the kind of assessment that we do? Or are we going to do the kind of assessment peer support was made to do, or that we've discovered, which is to hold up the mirror and help each other look at themselves, right? That's what we do. We help each other become the expert assessor of ourselves, all right, and be a better partner in the assessment process. We're not about prescribing, not just medication, but even telling you what to do with your life, right? We're about helping you discover what's important to you. Maybe sharing what's worked for me and what my experience is, but it's certainly not about telling you how to do yours because I did it this way. Or about predicting who's going to recover, who can't recover, who's more likely or not likely, all right? All again, going back to the assessment model. Those are some of the things that we won't be doing if we're going to be staying close to peer support as an innovative disruption. We're going to maintain our priority that the relationship is what we're about, that we're able to maintain a relationship, that narrative change and self-disclosure is a key part of what, if people say that self-disclosure is not a part of peer support, then what's happened to it, all right? And so I've heard it already. I've heard peer specialists telling me that they're not allowed to self-disclose, all right? I mean, really, so then what are you doing? You know what I mean? And then I didn't want them to get defensive about it, but I wanted them to like say, what are you doing instead? Well, I'm doing the screening, or I'm doing this, or I'm doing that. Well, let's think about maybe self-disclosure hasn't been, maybe there's not criteria we haven't come up with or taught how we really do it. But the bottom line is we've been able to share with each other our negative experiences, validate our feelings, be able to, have stories of overcoming challenges in life for centuries now, right? We can do it again and maintain that as a priority. So those are some of the major disruptions that we can bring forward. So let me see. I guess I'm doing a number of things, but I'm pretty much out of time. So I'm going to go back to this garden here because I like that one. So we, as I mentioned, family members, individuals, those of us who have gone through the process of going through a major disruption in our own lives, the people that are supporting us, providers, government officials, we're all part of this incredible movement. Those are the gardens. Those are the opportunities. And that's the role that lived experience and our social identity has the opportunity to embrace. Every single one of us has a lived experience and a social identity that contributes to this movement. We can all touch that lived experience if we choose. We can all connect with that if we choose. We can actually become that river. And actually, instead of having that river be this kind of dammed up, trickling little stream, it can actually become this roaring, raging, powerful river that runs beneath, that feeds and flows our movement as a whole. So that's what I hope we become. I hope you help me continue that work in that regard, and I really hope to continue to help you. So thank you for your time, and we'll go into the next one. Thank you, brother. All right. So do I take questions now? Okay, great. So there are some other things I can weave into our questions, or you ask some questions. Nobody wants to be that person that's keeping us all in this room.
I've got a question.
All right. What's your name?
Dave.
Dave, thank you, Dave.
First of all, thank you very much for incorporating the movement for equality and social justice into this conversation. And as I'm thinking about this idea of recovery-supported systems, it seems to me that there's a lot of indigenous ways of knowing and culturally bound ways that movement has taught us. Mm-hmm. So lessons from way back, right?
That's right.
That people have kept within their communities or as part of their communities to help them deal with unjust society. So I guess my question is how can this movement incorporate, or how does it need to incorporate maybe some of those culturally bound ways that have worked for indigenous peoples, for people of color, to kind of, that's sort of they already been doing, and what's the danger of maybe ignoring that history and that truth that has kind of led to this?
All right, well, okay, great question. Thanks again. And say your name again?
Dave.
Dave from where?
UTEP.
UTEP.
El Paso.
Okay, from El Paso. Okay, great. So Dave brings up this point around first the dangers. Well, the danger is that we end up ignoring great things that have been done and important literature that's out there. There's a pedagogy of the oppressed, Paulo Freire. There's liberation theology. There's all these really great rules for radicals. There's literature there that talks about how to really raise consciousness. So here's one example of the one from the indigenous communities I was involved in, for example, personally in Chiapas, Mexico. People were getting their lives in villages kind of ripped out from under them and given to government to run coffee and have coffee ranchers and take their land, and people are living on cliffs. All right. So instead of actually saying, wow, your life sucks, let's do some advocacy about that, right? What people did was they put pictures up of a person farming all right, and not even on a cliff, but just farming, and they said, what do you see here? So again, this is just a reflective example, right? So that person in the audience who saw that picture of farming is, well, I see a person farming, but that's not my life. I farm on a cliff. And every time I have to go up there, I might die. And the reason I have to farm on a cliff is because my family got run off of the land. You know, see where I'm going? So the stories start to emerge when we actually bring up images or bring up examples or bring up stories, and then people start bouncing off of that. All right, so that's just one of the examples of praxis from a consciousness raising perspective that didn't say, you know, let me tell you what's wrong with your situation, but actually facilitates a dialogue about what people think about their situation. So that comes straight out of every indigenous community work that's been done from a civil rights perspective. Great question. Does that help you answer your question? All right, great. Any others? Okay, if not, I'm going to keep going with one point until you get to the, come on up. There's this slide here that I put up around leadership that I want to mention, that when we think about our leadership, and this gets back to the point that was just raised, if we don't reflect on our own power and privilege first as leaders in a movement, we might end up with the same blind spots that our system and our other leaders have found themselves dealing with. All right, so whether it's cultural blind spots, right, privilege, social identity blind spots. All right, I'm going to do it. I have definitely done it. I probably did it today. You know what I mean? It's a part of what happens. So when you reflect on that, then you're able to get to this next level of actually thinking about being collaborative and facilitative, and actually think about what that means from a leadership perspective, and actually make that systems transforming. All right, so let's see. I can't remember. You were on. Okay, great.
You can go first. My name is Emily, and
And you're from where?
I don't know.
No, from where?
Oh, where am I from? Oh, I'm from Colleen, which is about an hour and 15 minutes north.
Okay, thank you.
Right next to Fort Hood. I'm actually a peer facilitator with a group called Bring Everyone in the Zone, and we
Cool.
do peer-to-peer support groups for military, active duty veterans, family members. And you mentioned a little bit about the ways to actually, I forgot the word.
To actually.
Evaluate
Oh,
the
yes,
programs.
yes.
And part of my graduate studies was trying to figure out different ways to evaluate. So how would you say is the best way to actually evaluate a peer support program?
Wow, great question. I mean, so I am not a researcher. Thank you very much. There are researchers here. There's a presentation tomorrow by Cheryl and Kim on participatory research. There's some mixed method approaches that have been emphasized. What we learned anyway thus far is that a mix of quantitative and qualitative analysis was important. That a purely quantitative model that measured what the system measures on its own wasn't going to be enough. But at the same time, if you just did a qualitative study of its own, that wasn't seemingly enough as well. So we needed to put that stuff together, and then we also needed to match that with good program evaluation, and I know you may not like this, but quality improvement data collection as well. All right, so not just waiting a year or 2 years down the road, but let's evaluate short-term kind of bundles of action and then evaluate. That can be a strong level of evidence base that we have not even come close to doing already. We can do that pretty easily. All right, great question. Thank you. Over here and then back over here.
Okay. My question is, we know that there is a lot of diversity within the states, and in Texas, it's a new and growing, fast-growing organization. And there are leaders out there that have come together and they've put together their own scenario of what a peer support organization should look like, and their ethics and whatnot. And so peers that are coming, that they're being trained and they're being put out there. And so they're bumping heads with the clinical side of things versus what the peer side of it. And so is there an organization that it might be forming or coming together a leadership type thing that peers can come to and say, okay, this is working in 10 states, and we want to bring it to our state, but we need some leadership so that we don't get that pushback and lose the integrity of being a peer support specialist.
Great question. Okay, so first I'll say that, by the way, what was your name and where are you from?
Cindy Trevino, and I'm from San Antonio. I am with
Okay.
Prosumers of San Antonio.
Okay, great, thank you.
Thank
All right, so, yeah, so if there's brass tacks, okay, there's brass tacks, which is the Bringing Recovery Supports to Scale Technical Assistance Center strategy. There's Recovery to Practice, certainly has technical assistance. I know it's going to be now coming to a close in terms of me, but you can request some technical assistance that actually says what's happening in other states in this regard and how can we apply that. From a broader perspective, STAR Center is one of 5 national technical assistance centers funded by SAMHSA to do just that, to actually provide some of the information that you might need that might say, okay, here are some things that you can actually move forward to recommend to your state or organization around systems transformation. I brought up a slide here that's really about those kinds of things that we can do. Peers can be not only grassroots community organizers, but we can be helpful and be at the table with policymakers, providers. We can become trainers and consultants. We actually proposed in New York to the Office of Mental Health there and said, let us lived experience leaders be the trainers for the system and train providers on recovery-oriented practice, right? Yeah, so that's what we did. We got the grant, started small, then we grew it, and we became those people that were actually helping the system become recovery-oriented in the way that Larry talked about. All right, go ahead, thanks.
Hi, my name is Donna Whitelow. I'm a counselor out of Houston, Texas.
All right.
And I've worked with a lot of smaller towns and cities. And there's not a lot of groups that are there. I just wanted to know, how can y'all raise awareness of where to go to, I guess, even local cities? I know they have the internet, but then you go to some of these things and the information is absolutely where it's not valid anymore, the numbers are not in, those type of things.
You mean the information about the peer support groups?
Yes, yeah, it's wrong. Or the people can't get or don't know where to go, and then they're calling insane asylums and different places in different big cities, and they're telling them, they're getting the runaround in smaller towns. And they don't have the access that larger cities do. So how can you guys raise awareness of, where to go to get this peer support, or even start those peer groups?
Great question. So one of the TA centers that's available is the National Self-Help Clearinghouse, Mental Health Self-Help Clearinghouse, and that's run by in Pennsylvania, Joe Rogers and Susan Rogers. They have a self-help directory that needs to be regularly updated by communities that are offering peer support. But I would start there, first of all, and ask Joe or Susan, say, hey, is there a way you can help us in Texas improve our inventory of what's available? You're also served by the National Empowerment Center here in Texas directly as one of the TA centers, and they also can help you maybe structure that and come up with a way to organize that as part of the peer specialist combination peer run organizational inventory. That's what we did in some other states, and that seemed to work.
Do you have the information on these people that you're naming?
Yeah, I do, both on my website at the STAR Center, that's consumerstar.org, all right, or on SAMHSA's website. Those are available as well. But I can also give it to you personally.
Okay, thank you.
Okay, you got it. All right, we have one more or done? Okay, great. Okay, yes, sir. I'm glad you came up. All right.
My name is Ron. I'm chaplain at Austin State Hospital.
Yes.
Just
Ron's
have
got
a
a very
comment.
important point, by the way. Check this out. All right.
A comment about peer support. Back in the 1930s, there was a minister that suffered from schizophrenia. He was hospitalized a number of different times and came out of the hospital and says, ministers need to know how to deal with this, and started a chaplain training program, which has resulted in hospital chaplains all over and worldwide clinical pastoral education. That's peer support.
Yep. That's right. That's right. Think about that. That's amazing. So it's not just Dorothea Dix, not just Batiste, right? It's as well as this chaplain. Incredible, incredible discoveries. So, I'll leave you with this. One of the things that made a profound change in my life because of these belief systems that I had, the believing that people were harming me, that the world was a dangerous place for me. Someone asked me, and it was involved in the peer support movement, and she said, how do you feel, first of all? I said, well, I feel unsafe, I'm afraid, I feel threatened, I feel angry. I was kind of in that place, right? And then she said, how do you want to feel? I said, well, I want to feel loved, I want to feel safe, I want to feel like I can contribute, right, that I belong. She said, what would you have to believe in order to feel that way? And at that very moment, a couple things happened. One is I wanted to say what I would have to believe and immediately just say, yes, I'm going to believe that the world is a safe place, that people love me, that my family wants me back, that, that I was going to list all those things. And at that very moment, almost like I was hanging on to a branch and that I didn't want to let go of, I realized that I was going to have to let go of that belief. And I didn't want to, because that belief, I thought, was keeping me safe. I felt safe with that belief. That belief was helping me feel secure. It wasn't always like, oh my gosh, what's going to happen if I let go? But it was, this is where I am, And so what would we have to believe? That's my story. But when we think about our story, when we think about the we story, what would we have to believe in order to be free? And that's the question we have to answer in order for this to work. So thank you very much. I'll see you guys soon. All right?